In November 2021, I was diagnosed with stage 1B breast cancer. Nearly a year to the day later, I was diagnosed with tongue cancer, which required multiple surgeries as well as going through radiation therapy.
So my cancer journey started in 2016, and it turned out through my biopsy that I had triple positive breast cancer. And so I had all the things: surgery, radiation, and chemotherapy. 2 years later, I had this headache that I couldn't shake. It turns out that it had metastasized to my brain. And then following that, I had radiation.
I was diagnosed with tonsil cancer in 2023. When they did the pathology, they determined that there was cancer in the tonsil, but it had also spread to my lymph nodes. So at that time, the recommendation was going to be initially just radiation, but when the lymph nodes came back positive, then they added chemotherapy to the treatment.
For me, radiation therapy was my personal choice. And I think that there's a lot of factors that you have to take into consideration. In order to have the best case at preventing recurrence, radiation would be my best chance.
Radiation is an extraordinarily safe and effective form of cancer treatment. With the technology that we use, we can provide such focus to the tumor while avoiding the normal parts of the body that we have a very, very high rate of effectiveness for treating or curing the cancer with very low rates of side effects.
I often hear things like, oh, I didn't know radiation could cure cancer, or what is going to be the goal with this radiation treatment? So oftentimes I'm reassuring them, if it's appropriate, if it's that type of cancer, for example, for prostate cancer, that the goal is indeed a cure and we can fully eliminate your cancer.
Radiation therapy has helped get rid of the cancer in my breast and then control the cancer in my brain. On the brain side, I was just surprised at how easy it was. I would tell someone who is offered radiation therapy to explore it. Talk about what those side effects might be, what the benefits are, and really explore it. It's really a decision, should be shared decision making between your care team and you.
My radiation oncologist is amazing. She came in, she talked with me, addressed any of my questions, just heard all of my concerns. I felt really supported by their team. Because no matter how I was feeling that day, they all kind of just really met me where I was.
I think one of the most special things about radiation oncology is that it's a highly skilled, highly committed team of professionals. The physician is just one part of it. Our nurses, our physicists, our therapists that deliver the treatments daily are just top of their game and just as committed to patient care. And so you have all these people looking out for you, and we will get you through this.
My treatment team did a really nice job of kind of reminding me of that. Like, you will get to the other side of your treatment. And so I just kind of kept focused on that I was in the moment, but I would get past the moment. I know radiation therapy was a huge part of why my cancer was cured. I feel very confident in that statement.